Welcome to the TRICARE4U.com web portal tutorial regarding behavioral health. If you are a TRICARE for Life beneficiary, Medicare Part B rules need to be followed when obtaining services related to mental health. Medicare is the primary payer for mental health care. You only need a referral or authorization from TRICARE if your Medicare benefits are exhausted. If Medicare benefits are exhausted, a referral or prior authorization is not needed for any outpatient mental health except psychoanalysis or substance use disorder care. If Medicare benefits have exhausted and treatment is from providers outside the network, this may result in higher cost sharing. Appointments may be scheduled with any TRICARE-Authorized Provider. An authorized provider is any individual, institution, organization, or supplier that is licensed by a state, accredited by national organization, or meets other standards of the medical community and is certified to provide benefits under TRICARE. There are two types of TRICARE-authorized providers. The first provider is a TRICARE Certified Mental Health Counselor, or TCMHC, and the second is a Supervised Mental Health Counselor, SMHC. Your provider can answer any questions regarding his or her certification with Medicare or TRICARE. There are services that are not payable to providers by Medicare, such as Behavioral Health and Social Service Providers, BCBA, Counselors, Addiction, Substance Use Disorder, Counselors Professional, Marriage and Family Therapist, LMFTMA, Mental Health Counselors, LMHC or LPC, and Pastoral Counselors. The Medicare explanation of benefits is not required. You can ask providers if they are TRICARE authorized to ensure the services will be processed according to your benefits. If Medicare has exhausted and the service is continuing, an authorization will be required for inpatient mental health care, substance abuse disorder, and psychoanalysis services. Providers will work with TRICARE to authorize services. It is important to get an authorization because retroactive authorizations are not provided, and there will be a payment reduction of 10% if an authorization was not done. The beneficiary is responsible for paying the balance to the healthcare provider. When a beneficiary is covered under Part B services, a Medicare explanation of benefits is required for TFL secondary mental health services on an outpatient basis when provided by the following providers: doctor or psychiatrist, clinical psychologist, clinical social worker, nurse practitioner, psychiatric clinical nurse specialist, certified nurse midwife, physician's assistant in a doctor's or other healthcare provider's office or hospital outpatient department. Mental health services that are covered by TRICARE and will be considered are listed here. Take a moment to review this information before continuing with the tutorial. This list is mental health services that are not covered by TRICARE. Take a moment to review this list before continuing with the tutorial. The most current out-of-pocket expenses, including copayments and cost sharing, can be viewed at tricare.mil/costs/compare. Please be sure to like us on our Facebook page and follow us on Twitter. By following us, you will be able to see upcoming events such as tutorials and webinars and when they will be held, along with other educational items that may be of interest. Thank you for watching our tutorial.